So tell us a little bit about the kinds of braces now that are totally invisible. How does that work?
Well, the best example of such therapy is, of course, Invisalign. Invisalign is a series of clear plastic aligners that fit
Look at that.
right over your teeth.
Unbelievable.
And are imperceptible to anyone unless you choose to share it with your friends.
And now, does Invisalign, does it shorten the amount of time that you have to wear braces, or not necessarily?
Well, the complexity of your treatment dictates how long you have to wear your appliance, but certainly it makes the psychological aspect of wearing something, a lot easier.
Absolutely. And what about the kinds of braces that go behind the teeth?
Of course, there are braces that can be bonded on the lingual or the inside part of a tooth. They're also very effective and are great at fixing.
Which do most people prefer, or which do you recommend as a dentist?
You have to look at individual patient's lifestyle, and of course every single treatment modality has its pluses and minuses. At our initial consultation we discuss what would fit an individual patient best.
And is this tooth, does this have an example of the interior braces?
Yeah, this is one of the interior braces. This just shows how it doesn't really need a rubber band anymore, and it can be, because it has this little snap-on door, which is pretty neat, which helps to keep the brace cleaner, because the rubber band really attracted plaque, and it makes the brace a lot more effective because the door presses the wire into the bracket, helping it to work faster. And of course it eliminates friction, because metal against metal moves a lot faster than metal against rubber.
And again, Dr. Buchholz, this wouldn't necessarily shorten the length of time that you need to wear braces. That would,
it would. This would, of course. This would.
By how much?
I would say by as much as 30%.
That's great. That's great. So are you seeing more and more even teenagers ask for this kind of orthodontia, or more for adults?
Well, no, I think this is appropriate for anyone, for any age, exactly. And we're trying to shorten the treatment time, because very prolonged treatment times can lead to damage of the root of the tooth and can lead to potentially gum problems.
Absolutely. And finally, what about cost? How do these new procedures compare to the traditional ones?
The cost for Invisalign and the lingual braces are slightly more expensive than the cost for a traditional braces or these new improved metal braces.
But it's not a significant price difference?
But it's certainly something that can be afforded.
Thank you so much, Dr. Buchholz. It's good to know we don't have to have a tin grin anymore. And thank you for watching.